have the 8th edition. It is chapter 16. Okay, so anxiety narcotics ما في فرق. إذا أكو فرق أنا راح أنبهكم عليه من نجي عليه بالقواعد. A chapter. So before starting with anxiolytic sedative, we are going to divide our lecture into two parts: anxiolytic and then sedative. Starting with anxiolytic, we have to know what we mean by anxiety. So anxiety is an unpleasant state of tension, apprehension, fear from unknown sources, symptoms characterized by sympathetic, increased sympathetic activity, tachycardia, sweating, increased heart rate, trembling, palpitation, and as such. Mild anxiety is a common life experience. Everybody, every one of us experience anxiety by any means, from family, from our environment, from our friends, from working places. So any man or woman can experience a certain kind of anxiety, and it is not a disease if it is mild, okay, and everybody can overcome it. But when it will be more than normal, that means we have to treat this condition. Treatment of anxiety by the following medications. First, we have the group that is named after this condition. أول واحد نسميه anxiolytic drugs. Anxiolytic drugs أو الاسم الثاني هو minor tranquilizers. What do we mean by tranquil? Tranquil? مهدئ. So minor tranquilizers, because we have the major tranquilizers, اللي هي anti-psychotic drugs أو anti-schizophrenic drugs. أدوية الفصام نجي عليها بعدين. So minor tranquilizers for anxiety, anxiolytic, and we have two kinds of drugs, mainly benzodiazepine used nowadays were previously barbiturates. Second, we have second part of the lecture is the hypnotics drugs, and we have some drugs اللي ممكن أن نستخدمها للانكزايتي antidepressant، ومن ضمنها selective serotonin reuptake inhibitor نجي عليها بعد. So anxiolytic or anti-anxiety drugs may be anxiolytic or hypnotics or antidepressant or selective serotonin reuptake inhibitors. Anxiolytic drugs, I'm going to discuss them in every group. First, we have benzodiazepine. It is the widely used, differ in terms of duration of action. They do not differ in terms of pharmacology. Mechanism of action, we said that within the central nervous system, we have the major inhibitor in neurotransmitter. What is it? Gamma aminobutyric acid. Gamma aminobutyric acid has two kinds of receptors. شنو هما؟ GABA A when موجودة centrally, and therefore benzodiazepine, since anxiety is a central reflex to environment, so therefore benzodiazepine binds على GABA A receptors. We said that we have different binding sites for different kinds of drugs. We have GABA channel site for the gamma aminobutyric acid neurotransmitter. We have a site for binding with benzodiazepine. We have a site for binding with barbiturate, and as such that we have different sites for binding with different kind of drugs. We have talked about that the gamma aminobutyric acid channel consisting of 5 subunits: alpha, alpha 1, alpha 2, beta, gamma, arrangement of different subunits راح يعطينا الجابا A receptors ويعطينا different responses. هذا راح يعطيني anxiety، هذا راح يعطيني hypnosis، هذا راح يعطيني anticonvulsant، وراح نحكيها ونشوف بعد. So they bind to gamma aminobutyric acid type A receptor مو بي موجودة بال وين؟ spinal cord immediate muscle relaxation. So ما علينا بيه. So it's bind to GABA A receptor on a specific site لازم, thus increasing the frequency of opening of the chloride channel. When you we increase the frequency, we get yes, more chloride can enter inside the cell, and therefore we get hyperpolarization. As we said, different subunits on the GABA A receptor will give us two different types of benzodiazepine receptors or binding sites. We have benzodiazepine 1 إذا عندي 1 subunit موجودة بالGABA A, وإذا عندي alpha 2 I will get benzodiazepine 2 receptors. هذا يعطيني different pharmacological actions. What are the actions of benzodiazepine? Benzodiazepine are not anxiolytic only. They have other effects. They have no antipsychotic effect. فإذا in terms of schizophrenia, I cannot treat my patient with these drugs. لازم استخدم وياه anti-schizophrenic. Also, they are not analgesic. They are not affecting the autonomic nervous system. We have very long list of different benzodiazepine. Diazepam, alprazolam, clorazepam, midazolam, triazolam, and as such. قلنا مختلفة in terms of what?
Duration.
Of what duration. أي اختلاف آخر ما عندي. What are the effects of these benzodiazepines? First, we have reduction of anxiety. Of course, this is the main indication. واسمها
anxiety.
يعني أفضل anxiety. So reduction of anxiety by binding to GABA A receptor. What kind? L2. Benzodiazepine 2. فإذا benzodiazepine 2 binding site اللي يحتوي على alpha 2 subunit راح ينطيني الانتي anxiety. Also, they may be sedative and hypnotic, and this is by binding to benzodiazepine 1 اللي يحتوي على alpha 1 binding site. Also, these drugs may cause anterograde amnesia. What do we mean by anterograde amnesia? شنو amnesia? Yes, I cannot remember. So retrograde amnesia, I lost my previous memory. Anterograde amnesia, فقدان الذاكرة الحالية. And this is very important in clinical procedures. مثلا أنا أريد patient مالتي relaxed during مثلا tracheoscopy أو colonoscopy أو endoscopy. أحتاج المريض مالتي relaxed وما يتذكر أنا إيش دا أسوي. أيضا الدنتست especially during surgical procedure مثلا wisdom teeth extraction. We need our patient to be relaxed, comfortable, and he cannot or she cannot remember what is going to happen by the administration of the prior administration of one of the benzodiazepines. Also, these drugs may be muscle relaxant, and this is by action mediated on alpha 2 receptors. They have also anticonvulsive effect, ناخذها ويا anticonvulsive drugs, and مثل ما شفنا الباكلوفين هو فقط على الجابا بي ريسبتورز وايضا ما له ابلكيشن هنا بالانزايتي فقط بالمصل ريلاكسيشن. ما له جابا بي ريسبتورز، ما له اي دخل بالانزايتي. اوكي، فقط جابا اي. So we should keep in our mind that anxiolytic drugs or benzodiazepine in general, مو كل الانxiolytic لأنه anxiolytic could be antidepressant, could be hypnotics and as such. So benzodiazepines in general, they have anxiolytic, sedative action, hypnotic action, muscle relaxant, anti-convulsant. عندهم 4 أشياء. أوكي؟ مرة ثانية.
Reduction of the anxiety. Anti-convulsant. Muscle relaxant.
Therapeutic application, anxiety disorder, general anxiety disorder, social anxiety disorder, performance anxiety disorder, post-traumatic stress disorder, obsessive compulsive neurosis, anxiety with phobia, for example from flying. Anxiety accompanies some forms of depression or schizophrenia. يعني anxiety in many situations I can find them with schizophrenia and with depression. لذلك anti depressant and schizophrenic ممكن أن تكون anti anxiety بس بالعكس الانتي anxiety could not be anti schizophrenic مثل ما قلنا نحن ولا شنو ولا anti depressant. Used for shorter duration because of addiction, كلهم لهم addiction liability, and tolerance develops for the sedative, for the hypnotic effect, but not for
anxiolytic.
يبقى الانxiolytic effect
موجود.
بس شنو يصير عندي hypnotic action والsedative action راح يصير عندي tolerance إذا ما أقدر أستخدمها for induction of sleep. What do I mean by tolerance? يعني شنو؟
The adaptation of the cell. Adaptation of this dose by the cell.
يعني شنو in terms of pharmacology كلمة واحدة يعني أريد واحد ما يفهم أشرح له هذا الشيء. يعني أقول للمريض يعني أنت تحتاج شنو؟
dose أعلى.
Yes, you need more dose
more
to get
this effect أو the effect.
Yes. Cross tolerance with ethanol. Keep in your mind يا جماعة يا future pharmacist أنه البنزودازepine they work like ethanol. Ethanol works like benzodiazepine. متشابهين بالأكشن. الغابائي receptors. Longer acting agents like clonazepam, lorazepam, diazepam, the duration of action. For شنو longer, شنو short. Alprazolam used for short and long-term panic disorder. Second action, muscle relaxant or muscular disorder, especially in spasticity, strains التواءات, multiple sclerosis تصلب الأعصاب, where cerebral palsy اللي هو neurodegenerative disease. Another effect هو الأمنيزيا كتشنع عليه كنا بالاندوسكوبي بالدنتستري. Anti-seizure as well. clonazepam, diazepam, lorazepam. طبعا الدايازيبام نستخدمه حالات الإبيليبسي by injection. intravenous injection status epilepticus اللي هو نوبات الاختلاج أو
صح.
grand mal status وبعدين نجي عليها بالشابتر لما وصلنا. كلور diazepoxide, lorazepate, oxazepam, diazepam may be useful for acute treatment of alcohol withdrawal. Why?
نفس الأكل.
أنا أريد أسحب برامج السحاب من الإيثانول. I have to use benzodiazepine in order to reduce the signs and symptoms until we gradually keep the patient or bring the patient into normal condition. Also, مثل ما قلنا قبل شوي, they have sedative and hypnotic action أو may be useful in sleep disorder. طبعا مو كل هالأشياء بس من نحكي عليها generally كلهم muscle relaxant, كلهم sedative, كلهم hypnotic, كلهم anxiolytic. من نجي على الابليكيشنز لا عندنا الهيبنوسيس عندنا دراجز خاصة من البنزودازولام اسماء معينة. من نريد انتي كونفولسنت مثلا كلونازيبام، نريد هيبنوتكس ميدازولام مثلا، نريد سليب ديس اوردر نستعمل لورازيبام بالبداية وهكذا. So sleep disorder, that means these drugs will reduce or decrease latency to sleep. What do I mean by decrease latency to sleep?
So يعني يصير sleep immediately يعني بسرعة.
Yes, يعني I will take less time
to sleep
to fall to sleep. مثلا أنا عندي إنسوم أبقى بالفراش فت ساعة لما تجيني النوم مثلا. يعني this is very long time. هنا أنا ما راح آخذ at bedtime آخذ البنزودازولام. يصير خلال 10 دقائق I will fall into sleep. So they will reduce the latency to fall into sleep. Increase stage 2 non-rapid eye movement. Increase stage 2 non-rapid eye movement اللي هي
deep sleep.
الستيج الثاني. دائما السليب والانستيزيا يرتبطون معا سويا. أول مرة نبدي sedation, بعدين يبدأ عندي stage 2 hypnosis, non-rapid eye movement, stage 3 deep sleep, rapid eye movement, وstage 4 يقول complete central nervous system depression and coma. طبعا stage 3 بيها anesthesia. Stage 4 we should not reach stage 4 because
coma دكتور.
there will be complete central nervous system
depression
and particularly the respiratory depression. Everything will stop there and the patient will die. So we shouldn't have to reach to stage 4. So benzodiazepine فقط why they are safe because فقط زيد لي stage 2. It doesn't reach to stage 3 or 4. تفرق عن الأدوية راح نحكيها بعد شوي. We have flurazepam, we have guazepam, they are long acting. Tinazolam, istazolam, intermediately acting. Triazolam, short treatment of insomnia. Flurazepam, rarely used. Why? Because it has an extended half-life and the patient will become so drowsy, sleepy all the day, ما راح يقدر يشتغل، ما راح يقدر يتنقل وهكذا. So Tinazepam for patient with a frequent awakening given 1 to 2 hours before bedtime. شنو frequent awakening؟ يعني مو مشكلة عنده بالنوم وإنما there will be frequent wakefulness. ينام ساعة ويقعد، ينام نص ساعة ويقعد، وهكذا في 4-5 مرات خلال 8 ساعات يعني ما راح يحصل على النوم المريح والهادئ خلال ساعات إلى 3 ساعات. Triazolam is a short-acting drug and induce يعني إذا أحتاج inducer أستخدم triazolam induce sleep and recurrent insomnia. Tolerance, withdrawal, rebound insomnia may be found with it for intermittent and not for daily use. فإذا أستخدم triazolam when I have recurrent sleep أو disturbance أو recurrent insomnia, وأيضا I should use it intermittently because of tolerance and withdrawal signs and symptoms. Keep in your mind that any drug that produces tolerance, physical dependence, rebound something مثلا مو بس الانزايتي insomnia أو يعني rebound something اللي دا أستخدمه أنا للعلاج. are short acting drugs. يعني راح يكون عندي أكثر with short acting. And if I have a longer acting agent, هاي الحالة راح تكون أقل. Tolerance, physical dependence will be lower for longer acting medication. And it will be more for short acting drugs. Coming to pharmacokinetic, they are lipophilic, rapidly distributed. قسمنا the duration of action إلى short و intermediate و long acting. أخذنا examples عليهم شوية. Metabolized in the liver, excreted in the liver. Dependence, of course, we said that any centrally acting drug عندنا مشكلة فيها بالدependence. Dependence will be psychological, physical, and withdrawal. Physical withdrawal هي نفس signs and symptoms اللي تظهر لي after discontinuation of the drug. أو إذا كان short acting after termination of action. It occurs slowly with longer acting agent, and it occurs more rapid with short action medication. Characterized by, of course, راح يرجع عندي كأنما الانكزايتي من جديد والانسومنيا من جديد. راح يصير عندي confusion, anxiety, agitation, restlessness, insomnia, attention, rarely seizure. حسب الشنو اللي دا استخدمه انا. دا استخدمه انتي سيجر يطلع عندي سيجر. دا استخدمه الانسومنيا يطلع عندي انسومنيا. agitation, anxiety حسب الحال. Adverse effect, of course, this is applied for any centrally acting drug. أي drug استخدمه ويشتغل centrally راح يكون به هاي الادفرس effect. drowsiness أي شيء يعني أنا أخذه حتى الأنتي هيستامينز أي منوم أي دايازيبام راح يسوي لي drowsiness, confusion, ataxia, early morning insomnia, daytime anxiety, amnesia, confusion. Precaution when we have liver diseases because they are metabolized in the
by the liver.
narrow angle glaucoma and alcohol. We have the only single drug that is going to antagonize every effect of benzodiazepines on benzodiazepine receptors, which is called flumazenil. كتبوا يعقوب لأن أنا ناسي. flumazenil. FLU ما ZE NILE. So this is a flumazenil, is a short-acting benzodiazepine receptor antagonist. أو أقول GABA أي receptor antagonist. يعني benzodiazepine أكثر شيء تشتغل على السايت مالتها هو GABA أي receptors. Since it is short-acting, so it should be given by intravenous infusion. It has rapid onset, very short duration, and بما أنه هو antagonist للبنزodiazepine, so it may precipitate withdrawal symptoms. Independent patient. Also, it may precipitate seizure when we use benzodiazepine for the control of epilepsy. Adverse effects of flumazenil: little dizziness, nausea, vomiting, agitation. It doesn't produce any problem. نستخدمه حالات toxicity with benzodiazepine. And keep in your mind that benzodiazepine are the safest centrally acting medication of all centrally acting drugs. They are the safest medication, even in toxic dose. حتى لو واحد ياخذه يعني toxic dose they are safe. ليش؟ لأنه الصفات اللي ذكرناها من وصل إلى
الكوما.
stage 3 اللي هو الكوما central nervous system. Coming to other anxiolytic drugs. Other anxiolytic. Antidepressant, they are first line for treatment of anxiety disorder in patient with a history of addiction or dependence. فإذا إذا أنا عندي المريض مالتي أعرف عنده addiction عنده drug dependency رأسا أبدي بيه ويا شنو؟ ويا antidepressant. Antidepressant عندنا نوعين نشوف when we are going to discuss them later. We have selective serotonin reuptake inhibitors like escitalopram and paroxetine, and we have non-selective. That means mixed serotonin norepinephrine reuptake inhibitor, and we have venlafaxine and duloxetine. طبعا أيضا مو كلهم، فقط الأنتي ديبريسنت نستخدمهم نختارهم، مو كل الأنتي ديبريسنت. The last two have lower potential for physical dependence, and they are approved for generalized anxiety disorder, and they are useful for long-term use. So if you want to treat your patient for a long time, you have to choose antidepressant.
دكتور العفو. The last two قصد ال SNRI مو دكتور؟
هذول ال reuptake inhibitors. They are mixed with a serotonin. Second, we have buspirone. Buspirone is an anxiolytic agent, but its action is not related to benzodiazepine receptors. Instead, it works on serotonin receptors, 5-HT1A, and on 5-HT2A and
D2.
dopamine D2 receptors. فإذا الانxiolytic effect of buspirone related to the action on serotonin rather than benzodiazepine receptors. It has a slow onset of action, useful for chronic treatment of generalized anxiety disorder. It lacks anticonvulsant. ليش؟
دكتور لأن
ليش ما عنده anticonvulsant؟
حاجة العرس بتاع السيروتونين.
ما عنده مو إجابة.
زين ما عندي إجابة. It has no muscle relaxant ولا شنو؟ minimum sedation. minimum sedation لأن ما يعني أي دراج ثاني ده يشتغل على غير البنزودازيبين ريسبتورز. فهاي الصفات المختلفة بما يختلف بين البنزودازيبين. Also, buspirone may cause hypothermia. That means reduction of temperature. And increase of prolactin and growth hormone. Why increase of prolactin here? Usually, prolactin is under the suppression or under the suppressive effect of dopamine. يعني احنا دائما الهرمون والنيوروترانسميترز دائما محفزه. هنا بالعكس البرولاكتين دائما عندي سبريشن
دكتور
سبريشن in men and women.
غالبا انه البريجننت وومن لما بيجي بيرث يعني برولاكتين راح يصعد عندهم راح يقلب الدوبامين يصير عندهم انكزايتي.
والانتي دوبامينرجيك دراجز انتي دوبامينرجيك دراجز سبيشالي راح نجي عليه الانتي سايكوتكس او اي دراج ياثر لي على D2 receptors معناه it is going to inhibit the inhibitory action of dopamine and therefore we can get hyperprolactinemia. And it is a condition which needs a treatment. Adverse effects مثل ما قلنا مثل كل centrally acting medication. The second part of the lecture is about hypnotics. the major group of hypnotic كل ما يجي يطبعنا على أنه هذا الدرug is a hypnotic معناها عندي barbiturates. Barbiturates are formerly used to induce sedation and induction and maintenance of sleep. هذا الغرض يعني صنعوا من أجله مثل ما يقولون. هذا الباربيتوريتس قبل اكتشاف البنزودازابينز. They are not safe medication. They induce sleep, prolonged period of sleep, stage 2 and 3, and they will lead to coma and complete central nervous system depression. So they are not safe. They are toxic in terms of high dose or when the level of their concentration in the blood will be increased. So they are replaced by benzodiazepine. Induce tolerance, physical dependence. Induce drug metabolizing enzyme. لذلك أيضا they are not safe for us لأنه راح نشوف many drug interactions with these medications. So they are enzyme inducer. They are enzyme inducer of metabolism of themselves and for other medications given at the same time. Severe withdrawal symptoms may be found. Toxic dose may induce coma بينما بالبنزودازepine they cannot. Classified أيضا إلى long acting phenobarbital which is water soluble, half-life more than 1 day, used for treatment of seizure. Short acting, we have pentobarbital, secobarbital, amabarbital, butalbital. They are used for production of sedation and hypnosis. Other application nowadays is not used. Where third, we have ultra short acting. Ultra short acting thiopental, which start from second to 30 minutes ويخلص الأكشن مالتها, used intravenously for induction of anesthesia. Ultra short acting. بالنسبة للونج acting excreted by the urine. زين. short acting metabolized excreted. Ultra short acting, their action is terminated by redistribution. شنو يعني؟ يعني they are highly lipid soluble ورأسا من أنطيها تدخل إلى central nervous system. They will give the action and then they rapidly redistribute from the central nervous system into peripheral tissues, adipose tissues, muscle, أي مكان به lipid راح وينتهي الأكشن مالتها بشكل سريع. فلذلك they are ultra short acting. mechanism of action.
دكتور العفو، هسه الفينوباربيتال يعتبر لونج اكتنج لو اثنينهم؟ يعني مو حاطين بالخانتين؟
فينوباربيتون more than 1 day.
وهنا هم بالشورت مكتوب فينوباربيتال اول واحد.
وين؟
بنتو.
اوكي.
How they are going to act. Also, we have a binding site for barbiturates on GABA A receptors. مختلف عن البنزودازepine, مختلف عن الجاما aminobutyric acid. But in this case, these drugs are going to prolong the duration of opening, not to prolong the frequency or increase the frequency. They prolong the duration of opening. فحصل نفس النتيجة. More chloride will enter. They have an extended effect. مو فقط على الجابا A receptors. They have extended action. What are they? What are these actions? They block the excitatory neurotransmitter glutamate. In addition to potentiation of the inhibitory GABA, they also suppress the excitatory glutamate. Block sodium channels. The number of sodium channels here responsible for the action potential. So when they block sodium, they will make the cell in the resting state and all lead to decrease in neuronal activity. فإذا mechanism of action of barbiturate تشمل كل all these effects. Coming to the actions, central nervous system depression طبعا dose dependently. Dose dependent. أول ما نعطي barbiturates in small doses we get sedation اللي هي راح يشبه الأكشن مال البنزودازيبين. But this action is not نقول يعني specified. راح يصير بي extension شوية إذا زيدت الدوز شوية إذا عندي drug interaction راح يعبر عندي from the sedative effect إلى relief of يعني sedation أو relief of anxiety و calming effect of excitation إلى hypnotic action. فإذا أول شيء sedative anti anxiety أكثر شوي راح يصير عندي hypnosis induction of sleep. بعد أكثر من السليب يصير عندي anesthesia. أكثر من الانستيزيا coma and death. بنزودازيبين ما وصلت لهذا الحد، وصلت hypnosis وانتهت. stage 2 non-REM sleep فقط. لأن وين بقى أوصل؟ complete central nervous system depression.
دكتور العفو.
Also they are not analgesic. Chronic use lead to tolerance and depress cognitive development if you use them for children, especially for epilepsy, and it will decrease the cognitive performance. مثلا أحل أسئلة عندي تطبيق في الشيء calculations بي ما أعرف أسوي إذا أنا ما أخذ barbiturates. الطفل لا يأثر على شنو؟
على الكوجنيتيف
الديفلوبمنت. الادلت لا performance. اوكي.
بس العفو اول نقطه اي باللو دوزز تسوي سيديشن واكزايتمنت.
No, relief of excitation. Relief. يعني calm the effect and excitation.
calm the
effect and excitation. Therapeutic uses إن الاستخدام هو sedative hypnotics لأنه خاف منه. So they are only applicable for anesthesia. Ultra short acting thiopentine. Also they may be useful for anticonvulsant effect. Phenobarbital for tonic chronic نجي عليه بعدين. Mild sedative for anxiety, nervous tension, insomnia. وقلنا هذا الابلكيشن بنستخدمه حاليا. وhypnotics أيضا they suppress REM sleep. مختلف. نعم.
كان نان
من وصلنا الريم سليب هاي الستيج اللي بعدها يعني ستيج 3 وصلنا. بنزودازيبين من وصلنا إلى ستيج 3. Also they are lipid soluble, distributed into the central nervous system, metabolized. They are enzyme inducer, excreted by kidney metabolite or within the gastrointestinal. adverse effect نفس الادفرس effect اللي نشوفها in every centrally acting medication. We have in addition to that drug hangover. What do we mean by drug hangover?
هاي مثل هاي يكون هاي دكتور يعني منتشي او هيك هانج اوفر.
تبعات العلاج
يعني شنو؟
اللي بعد ما تاخذ
شو نسميه؟ دائما الادكت تشوفهم هذول الايثانول اللي ياخذ دايازيبام شو يكون مثلا اذا ماخذها بالليل الشرح يكون
لما يصحى يكون دائما عنده نوجيا
nausea, vomiting, confused, they cannot drive, they cannot run machine, and هذا الافكت اللي يظهر بعد اليوم الثاني نسميه هانج اوفر او بعد الثمال نسميه. So tiredness, nausea, dizziness وهذا. Decrease the duration of drug that are metabolized by cytochrome. مثل ما قلنا لأنه they are enzyme inducer وعندي الميتابولايت مالتي البورفرين أيضا metabolism or synthesis will be increased. Physical dependence, abrupt withdrawal, may cause tremor, anxiety, wakefulness, restlessness, nausea, vomiting, delirium, cardiac arrest, poisoning. It will lead to بعد الكوما complete central nervous system depression of the neuronal drive for
The respiratory.
respiration, and therefore it will lead to death. Other hypnotic agents أيضا كجروب مثل ما حكينا كجروب hypnotics هي عندنا الباربيتوريتس جروب anti anxiety benzodiazepine major. ممكن أن نستخدم other drugs for treatment of insomnia أو as hypnotics. First we have zolpidem. Zolpidem is a non-benzodiazepine. That means it has no the structural
of the benzodiazepines.
feature
Yeah.
of benzodiazepine. But it acts on benzodiazepine receptors.
Analog
هو
دكتور.
non-benzodiazepine acting on benzodiazepine receptor. شنو فرقه؟ It has no anticonvulsive effect and no muscle relaxant properties. فقط شنو؟
sedation.
منوم.
Hypnotic.
Low withdrawal effect, rebound insomnia and tolerance. أقل من البنزودازepine. ليش؟ لأنها it doesn't work extensively like benzodiazepine. Rapidly absorbed, half-life 2 to 3 hours. Hypnotic effect may last for 5 hours, metabolized by cytochrome and therefore affected by enzyme inducer or enzyme inhibitors. Adverse effects also مثل البقية. Zolpidem is a second hypnotic agent. Similar to zolpidem أيضا non-benzodiazepine acting on benzodiazepine receptor. Fewer residual effect on psychomotor and cognitive function. دائما أشوفه ويا البقية benzodiazepine بينما هذا ما أشوف residual effect on psychomotor الحركة ولا الذهن ما أشوف به هذا الإفكت. half life 1 hour metabolized by cytochrome as well. And zopiclone. Zopiclone is orally active hypnotic, non-benzodiazepine as well. Act on benzodiazepine 1 receptors, used for up to 6 months. أقدر أستخدمه لفترة طويلة بأمان. Rapid absorption, peak 1 hour, extensively metabolized, excreted in the urine. Adverse effect نفس اللي نشوفها بالother central nervous system action. Zolpidem, zolpidem and zopiclone هذول الثلاثة are controlled substances. You should save them and you shouldn't dispense them
Without.
only under prescription. Okay? So they are controlled substances. They do not alter sleep stages. بينما الباربيتوريت غيرت لي sleep stages, البنزودازepine غيرت لي sleep stages, and they are preferred hypnotics and because of selectivity for benzodiazepine 1 receptors. لا لها effect على 2 ولا على 2 ولا okay. We have another hypnotics, but we cannot consider it as a drug. We have ranoltione and tasimultione. What is the hormone in our body responsible for our sleep regulation?
Melatonin.
Melatonin. تمام. So it is the hormone responsible for
Sleeping.
regulation of circadian rhythm between day and night. تمام. This substance يعني thought to play a
Increasing.
role in يعني facilitating or induce sleep. اكو ناس تستخدمها يعني تستفاد منها وعلى الغالب كفارماكولوجي it is not, it has other actions. زين راملتيون انتاسيملتيون they are خلينا نقول derivative او selective agonist at MT1 and MT2 subtypes receptors for melatonin. And melatonin is a hormone secreted by the pineal gland, as you know, الغدة
صنوبرية
that helps to maintain the circadian rhythm underlying normal sleep-wake cycle. The stimulation of MT1 and MT2 receptors by ramition and tassimation is thought to induce and promote sleep. Thought. البقية أخذناهم لا they are pharmacological substances by working on benzodiazepine on GABA receptors وخلاص. هنا الرول مالته مختلف شوي. They may help in some cases of insomnia. They have minimum potential for abuse. لا تشتغل على الباربيتشور لا البنزودازepine ولا جابا ولا تسوي potentiation للانهبيتوري ولا تسوي activation للexcitatory أو inhibition. And no evidence of dependence or withdrawal that has been observed. Therefore, ramition and tassimation can be administered for a long time. Ramition indicated for treatment of insomnia characterized by difficulty in falling asleep, يعني increase sleep latency, increase sleep latency. Common adverse effect include dizziness, fatigue, somnolence, increase prolactin level. Tassimation is indicated non-actual indication مالته مختلف for non-24 hour sleep-wake disorder. وين نشوفه in blind patients, in blind people أو prisoners ما يدري ليل من نهار. زين؟ So those people they have abnormal or disorder regulation in 24-hour wakefulness and sleep. So tassimation may be useful for this condition. The most common adverse effect of tassimation, headache, abnormal dreams, increased liver function, and possible upper respiratory tract infection. Metabolized by cytochrome, and therefore they are subjected, or their concentration may be altered by the presence of enzyme inducer or inhibitor. Also, everybody knows that antihistaminics may have, especially the first generation, H1 receptor antagonist, they have some sedative action. تمام كلنا ناخذ الانتي هيستامينيك ونشوف شو يصير فينا. رأسا sedation ونروح ننام رأسا. So mild insomnia may be treated with antihistaminic. لأن antihistaminic بها extended actions. أول شيء antihistaminic action, anticholinergic, where anticholinergic effect is يعني centrally و يعني mediated by central action. So in mild insomnia, antihistaminics مو كلها طبعا, especially those diphenhydramine for motion sickness, hydroxyzine, بعض حالات التشينج, البورفيريا, يعني any allergic condition that may produce some kind of uncomfortableness during the night or that prevent the patient from sleeping, especially severe itching. The hydroxyzine may be useful for those purposes, and doxylamine in pregnant women يستخدم safely. Of course, all of them have anticholinergic action. Also, antidepressant may be useful to give a sedative and hypnotic action, but not all of them. Example, doxepine old antidepressant نسميها cyclic antidepressant نجي عليها شيء بعدين. لما عندنا tetracyclic وعندنا tricyclic فنسميهم old antidepressant. والسلكتيف سيروتونين نوع ابنفريني ابتيك انهبيتور. ليش ما قلنا اس اس ار ما خليناه وانكزيوليتكس؟ ليش ما خلينا الاس اس ان ار وياه؟ mostly SSRI are stimulatory يعني they are antidepressant but when the patients take them at night they will promote insomnia. Therefore you have to ask your patient or during your administration of the drug to give him or her that or tell him or her that this medication should be used during the day. الصبح للظهر. ناخذه بالمساء يعني it will prevent sleep. ما ينطبق على الميكست selective serotonin norepinephrine reuptake. راح نجي عليه شيء بعدين بالانتيدبريسنت. Approved at low doses for insomnia. Tricyclic antidepressant with antihistaminic action. أيضا تفيدنا حالات الانسومنيا. The last one we have suvorexant. Suvorexant is an antagonist of orexin receptor. What is orexin receptor? Orexin is a neuropeptide. What is the role of this neuropeptide? Promote wakefulness. So it is a neuropeptide present in our central nervous system, acting as neurotransmitter to promote what?
wakefulness.
Receptors مالته شنو؟ orexin receptors. Suvorexant شنو is a blocker of orexin receptors or orexin receptors antagonist. If you block this action, what is going to happen?
Sleep.
Sleep. Induction of sleep. So it is an antagonist of this neuropeptide. This antagonism may also explain the adverse events that are similar to the signs of narcolepsy and cataplexy. أول شيء أرجع شوية معلومات. What do I mean by a neuropeptide? Yes. So this is the characteristic of a neuropeptide as a transmitter. قلنا responsible for wakefulness. إذا هو responsible for wakefulness وأنا إيش دا أسوي؟ I'm going to suppress it, to suppress that neuropeptide that's responsible for my wakefulness. شو راح يصير بي؟ I will fall into sleep. صار عندي كأنما الحالة مثل مرض النوم. شنو مرض النوم؟ ناركوليبسي. كاتالبسي شنو؟ ترنح من بعد أو الدوخة أكثر من الدراوزنس. So if you give this medication كأنما يعني you are going to induce narcolepsy. كأنما أنت سويت مرض النوم. هذا الشخص he or she can fall into sleep. يعني حتى أي مكان قاعد بس شوية إذا ما حد يحكي وياه أحسن. يعني we can find those people in our population ينامون يعني. وين يقعد مكان بانتظام فد شيء مثلا إذا ما حد يحكي وياه يلاقيه فد شيء he or she will fall into sleep. This is narcolepsy. Okay? A disease. مرض النوم. So you are going to induce a condition similar to narcolepsy when you use suvorexant. Okay? The loss of orexin producing the neuron is believed to be an underlying pathology of narcolepsy. ليش هذول الناس نشوف عندهم مرض النوم؟ لأنه they have low
بالضبط.
affinity أو abnormal orexin receptors. زين؟ ما عندهم orexin receptors طبيعية, so they always feel with sleepiness. Daytime somnolence. يعني شنو somnolence؟ نعس. And increased suicidal ideation. Another reported adverse effect of suvorexant. Even it is not safe to be used. Suvorexant mainly metabolized by cytochrome, لذلك subjected to drug metabolism, يعني induced. That's it.